Thank you, Mr. Speaker. Obesity robs children of the best possible start in life, hits the poorest hardest, sets them up for a lifetime of health problems and costs the NHS billions. So I can announce to the House we're expanding the soft drinks industry levy to include bottles and cartons of milkshakes, flavoured milk and milk substitute drinks. We're also reducing the threshold to 4.5 grams of sugar per 100 millilitres. Mr. Speaker, this government will not look away as children get unhealthier, and our political opponents urge us to leave them behind. Thank you.
The only thing I would say is at least we're hearing it first in this House and on Sky. Sir Alden.
Thank you, Mr. Speaker. Can I congratulate the Secretary of State and the Health Department for the launch last week of the Men's Health Strategy. My constituent, Philip Pirrie, who sadly lost his son to suicide, has been calling on the government to launch a public health campaign to reduce the stigma of suicide. Nearly 75% of those who lose their lives to suicide have not been in contact with mental health services, and that's why we need to reach out. So will the Secretary of State meet with myself and my constituent to discuss such a campaign?
Thank you, Mr. Speaker. I'm sure my honourable friend, the Minister, would be delighted to. The Men's Health Strategy sets out precisely the challenge in those terms, and through the partnerships we've already announced with people like the Premier League, as well as the people who've been knocking at our doors to get involved in such a campaign, I'm absolutely confident that together, collectively across the House and across the country, we can tackle this terrible stigma.
Jacob Collier.
Mr. Speaker, it's great news that we're starting to see NHS dentists return to Burton-upon-Trent, but my constituents in Uttoxeter are still without an NHS dentist for adults. For a growing town of over 16,000 people, when can my constituents expect to put a smile on their face?
I thank my honourable friend. He's a tireless campaigner on this issue. We want to see more dentists in Burton and Uttoxeter and across the country. That's why we're offering dentists £20,000 to work in underserved areas. And we're making it a requirement for new dentists to practice in the NHS through our tie-in policy. We're also making additional urgent appointments available across the country, including in my honourable friend's for my honourable friend's constituents in Burton and Uttoxeter.
Show Secretary of State Stuart Andrew, the birthday boy.
Thank you, Mr. Speaker. Can I ask the Secretary of State why he hasn't sorted out the strikes and disputes?
Yeah, quite right.
Oh, Secretary of State.
Can I wish the Shadow Health Secretary a very happy birthday, 21 again. It's good to see him here. Mr. Speaker, we continue to hold the door open to the BMA. If they want to engage constructively, we are ready and willing. What we will not do is be held to ransom. What we cannot afford to do is pay more than we already have. What we are able and willing to do is go further to improve their career progression, their job prospects, and to work with them to rebuild the NHS the party opposite broke.
I've got to get through a lot of topical. Stuart Andrew.
But, Mr. Speaker, the power to stop these strikes is in the government's hands. They need to sit down and negotiate to end the strikes. But ministers are too busy briefing against each other. Not my words, the Secretary of State's words when he was standing here. He said it was so simple. It's the Secretary of State that is embroiled in a leadership battle that's taking over focus on averting walkouts. And the Employment Rights Bill that reduces voting thresholds on strikes and scrapping minimum service levels. So does the Secretary of State accept that things are only going to get worse as a result of the bill? And in his words, does he agree that patients have suffered enough?
But, Mr. Speaker, I was very clear in opposition about the government's responsibility to sit down and negotiate. That's exactly what I've been doing. It takes two to tango. As for the other trivial nonsense he mentions, I've been very clear that I am a faithful, but of course if he were a game show, he'd be pointless.
Katrina Murray.
Thank you, Mr. Speaker. There's a higher prevalence of multiple sclerosis in Scotland than there is in any other part of the UK. What steps is the Department taking to ensure that with the MS, the people living with MS can access both a timely diagnosis and an equitable specialist care regardless of where they live in the UK?
Minister.
I thank her for that question. It's a very important point that she raises. I'd be more than happy perhaps to meet with her to discuss it because I think it needs some detail on the complexity of what she's raising.
Morgan, Liberal Democrat spokesperson.
Thank you very much, Mr. Speaker. Every MP will be aware of the huge value that unpaid carers add to the NHS, taking the pressure off for paid carers, often under under intolerable pressure. We're therefore really pleased to hear the news this morning that thousands of unpaid carers will have their cases reviewed after they were left with huge debts by failure of government over a long period of time. But it's been reported that debts will continue to accrue and overpayments will continue to be pursued for as long as a year from now. Given his responsibility to unpaid carers, will the Secretary of State raise his issue with colleagues, urging them to suspend repayments until the recommendations are in force and ensure those people propping up the care system are treated fairly from today, not a year's time?
I'm very grateful to the honourable member for that question. This is a terrible situation, one of many messes this government is now working to clean up. And I will certainly make sure that the issues she raises are taken up with my right honourable friend, the Work and Pension Secretary.
Tristan Osborne.
Thank you, Mr. Speaker. The Public Accounts Committee has recently scrutinised the state of clinical negligence in the UK. At £60 billion, the government liability for clinical negligence has increased under the last government significantly. The government has commissioned David Locke to review the issue. Does the Secretary of State agree with me that reform is desperately needed in this space?
Minister.
I'm grateful to my honourable friend's question. He's absolutely right. As announced in the 10-year health plan, David Locke, KC, is providing expert policy advice on the rising legal costs of clinical negligence and how we can improve patients' experience of claims. This review is ongoing and following initial advice to ministers and the recent NEO report. The results of David Locke's work will inform future policy making in this area, and I'm very happy to update him as soon as this happens.
Dr. Danny Chambers.
Reports that 1 in 3 adults have been relying on chatbots and AI tools for mental health advice and therapy are concerning because they're currently unregulated and potentially dangerous. One reason people are using these is because mental health waiting lists are so long. What is the Minister doing to reduce mental health waiting lists so that people can speak to a qualified mental health practitioner instead of relying on unregulated AI tools?
Thank you, Mr. Speaker. I'm happy to report to the honourable gentleman we are well on the way to delivering the 8,500 more mental health staff we promised our manifesto, well over 6,500 already there. In terms of digital tools, these can play a role, but I'm pleased to report that in terms of the evolution of our online tools via the NHS app, making sure we have high quality and clinically verified apps will be part of that approach so that people can get access to high quality digital tools, not ones they've Googled on the internet.
Keller Stevenson.
Thank you, Mr. I commend him for reaffirming his commitment to drive forward digital innovation in the NHS. Does he agree with me that Scotland should mirror the UK so that we do not fall behind the pace in a development that could be game-changing in terms of outcomes for patient and staff alike?
Minister.
Mr. Speaker, while the NHS in Scotland has no app and no plans for national rollout, the NHS in England has had an app since 2019, with 71 million logins in October 2025. 3 in 4 people now have the app in their pockets, and they have more subscribers in England than Netflix. Why, might you ask, Mr. Speaker, does NHS Scotland not have an app? Well, the answer might come in an FOI request by the champion journalist Simon Johnson. When asked about some of the drawbacks of applying an NHS England app in Scotland, they said, political optics of adopting an English solution. Analog John to move over and let Anna Sarwar and Jackie Bailey finally drag the Scottish NHS.
We are on topicals. The Prime Minister is here. If you don't want members to get in, please tell me. It'd be easier. Sarah Dyke.
Speaker, in Somerset, only 41% of children have seen an NHS dentist in the last 2 years, well below the national average. Ben from Somerton is a single parent of 4 children. He lives in an NHS dental desert and worries about the health of his children's teeth because there is no way that he can pay for private dental care, as he can barely afford to pay for his children's food. So ahead of the budget tomorrow, can the Minister confirm what actions he is taking?
I thank her for that question. We have the interim reforms, our response to that being published very, very soon. We are working on the long-term reform of the NHS dentistry contract with the BDA. I'd be happy to keep her updated on our progress.
Rand.
I'm proud that this government has invested record amounts into our National Health Service, and in Altrincham and Sale West the results are clear. Waiting lists down 10 months in a row, extra investment in local GP surgeries, and most recently a new skin cancer diagnostics centre at Altrincham Hospital, ensuring early intervention at the heart of local healthcare. Does the Secretary of State agree with me that this is exactly the change we were elected to deliver?
Yes.
Yes, Mr. Speaker, they don't like to hear it opposite, but we are bringing waiting lists down for the first time in 15 years. Patient satisfaction with general practice is rising, and we're delivering the investment, the modernisation and the change the country voted for.
Pepe Hailing.
2 weeks ago, I asked the government whether it held discussions with Cambridgeshire Integrated Care Board on the 16,000-strong petition to save beds at the Arthur Rank Hospice. I was informed that it will not be possible to provide a response within the usual time period. So I've got a simpler request. Will the Minister meet with me and the new Central East Integrated Care Board to discuss how to identify needed strategically commission beds?
Yes, happy to meet.
Peter Swallow.
Mr. Speaker, Bracknell is a life sciences superpower with Eli Lilly, Sandoz and Boehringer Ingelheim all having a footprint in our town. What can we do to speed up clinical trial setup to help deliver the next generation of treatments for our NHS?
Minister.
Mr. Speaker, the Government is already committing to clinical trials being under 150 days by next March, and I commend my honourable friend of all the work he does with his local pharmaceutical companies in advancing medical science locally and nationally.
David Mundell.
Thank you, Mr. Speaker. The Secretary of State will be aware that since the law changed, the number of children who have received NHS prescriptions for severe epilepsy for medical cannabis is pitifully low. Families and campaigners believe that part of the reason for that is that the Home Office still has a large amount of responsibility for these products. Will he meet with me and other interested MPs to discuss whether his department could take more responsibility?
Mr. Speaker, the Government, although has no plans to change departmental responsibilities applicable to unlicensed and cannabis-based products, it is cognisant of the need for research in this area. We have agreed to over £8.5 million in funding for 2 world-first clinical trials to investigate the safety and efficacy of cannabinoid treatments for drug-resistant epilepsy in both adults and children, and I'm happy to speak to him about this further.
Sonia Kuba.
Mr. Speaker, I've seen firsthand how severe MSK conditions such as lower back pain can devastate the ability to work, have relationships, sleep and overall well-being. With over 1 million children's education disrupted by MSK conditions with missed schooling and fragmented, hard-to-navigate services, will the Minister prioritise MSK conditions in Phase 2 of the Modern Service Framework and confirm when that will be published?
Well, could I pay tribute to my honourable friend for saving the Ladies' Walk Health Centre, which the party opposite was trying to shut in her constituency. We are advancing modern service frameworks for those conditions where we can swiftly and significantly raise the quality of care. The National Quality Board makes recommendations on future modern service frameworks, and the NQB's next meeting is on the 8th of December.
Sir Roger Gale.
Mr. Speaker, it's estimated that there are some 200 highly qualified Ukrainian dentists resident in the United Kingdom as refugees. They could be working for the health service. Because of the moribund attitude of the General Dental Council, they're not allowed to do so. Can we try and drag the GDC into at least the 20th century so that these talents can be utilised?
I thank him for that question. I met with the GDC very recently. They have completed the procurement of the new management agent for running the ORE. I'm confident that we're going to see a significant boost in the numbers, and that is coming on stream very quickly. But I agree with him that it's been too slow and it needs to speed up.
Sarah Smith.
Mr. Speaker, in my constituency of Hyndburn, about 38% of children are sadly growing up in poverty. This government is committed to ensuring the best start in life for all children. So in addition to the increase in mental health support teams in schools, does the NHS workforce plan currently address the vital need for trained specialist community public nurses in schools?
My honourable friend is absolutely right about the need to improve the quality of the paediatric workforce. We're considering that as we revise the workforce plan, and I'm proud that already, with just one decision we took in the first year of this Labour government to expand free school meals, we'll be lifting 100,000 more children out of the poverty they were left in by the party opposite.
Final question, Seamus Logan.
Thank you, Mr. Speaker. In 24-25, the NHS Trust and the Secretary of State's constituency collected £2.4 million from patient and visitor parking and a further £1 million from staff parking. Given these costs fall hardest on the poor and the most seriously ill, will he now consider abolishing this inequitable burden on the sick, their relatives and those who care for them?
Mr. Speaker, if I were him, I'd be more worried about the situation close to home, because under the SNP's abysmal record of failure, whereas waiting lists are falling in Labour-led England and Labour-led Wales, in SNP Scotland they are rising, despite the biggest funding settlement since devolution began, a record that should make him and his party blush.